So I've been taking Zanubrutinib for around 6 months now for my CLL. I guess the question would be, has it actually worked? In this video, I'm going to look at what happened to my blood results, how I'm feeling, the side effects I'm experiencing, and effectively what's going to happen next. So if you remember back in January when the treatment started, what had happened was my blood test results had got to a point where my hemoglobin was dropping below the 100 barrier, and my white cell blood cell count was above the 200, well, it's 219 when I originally started. Now, what they quite often say is it's not always those things immediately that cause it, but what I was feeling and what I hadn't noticed was I was feeling very tired. Now, there are a number of different treatments, and Zanubrutinib is one that is more commonly used with people who've got what I've got, which is this TP53 gene mutation, which, lovely as it is, does make the Zanubrutinib harder working on your body. Not the Zanubrutinib, does make the CLL harder working and more impactful on your body and likely to return more quickly. So that's why the Zanubrutinib was chosen as my specific treatment. So we're 6 months in, and what's happened? I had a consultancy appointment over the last couple of months, or last month, and what they got to with it was that effectively my white blood cell count is now down to 70, which it's supposed to be between 4 and 11. So there's still a little way to go. And generally, you know, they're very much kind of focused on that as a result. And my hemoglobin is now back above 100, which is obviously, again, that does take a little bit longer to respond, but they are noticing that one coming back up. So effectively, the medication is on path to do what it's meant to do. And what I've noticed from a physical perspective is and I think I went through a bit of a honeymoon period in the early January after I started taking it, where I was feeling a bit of a honeymoon period of taking the drug, when actually it was unlikely to have had any effect at all. So that, I think I went through that. And then I went through a period where I noticed a lot of things with my skin, as I think I've mentioned, and various other things along the way that really impacted how I was feeling. So that was quite hard to deal with, and I've noticed, particularly with my diabetes and my type 1, the blood monitoring equipment and also the insulin pod that I wear leave marks, do bleed more easily, and I'm in a little bit more pain wearing them. So those things, you know, have happened, and I have noticed them. But I do believe my energy got a lot better. So as I comment to Tal, I've become unerringly irritating again. So I'm definitely back in a place where I'm feeling better. But that does go a bit up and down. I suffer from tiredness, and it has been impacted quite heavily by the hot period that we're going through at the moment. So aside from the skin in terms of side effects, I have noticed kind of a few other bits and pieces. When I take the tablets first thing in the morning, they can make me feel a little bit unwell. So one of the mechanisms I've actually gone through to get around that is to eat a little bit of food before, and that has had a huge effect, although I still do notice that I do feel a little bit unwell. When I eat large meals, I still think my spleen is oversized, although I haven't had that measured since I've started taking it. So that's a little bit, I've still got some work to do there. And I do feel that my spleen is quite regularly telling me to behave myself and kind of back off a little bit of food, maybe not drink quite so much, and so on. So all these things are kind of ongoing. And so I think overall, there are a few side effects, but do they outweigh the overall impact of the drugs that I'm feeling? Probably not. And that probably leads me on to the next bit about how I actually feel. I have got more energy than I had before. And I think I've said that I went through a period last year. It's one of those things where you don't necessarily notice it. I was actually feeling quite significantly more tired, and finding it hard to exercise and all those kind of things. But I now have a wealth of energy. I'm exercising again. I purchased a hybrid bike to help me out while I was doing it. And while I was on holiday over the last couple of weeks, I did ride a normal bike and didn't really notice any problems with it. So I think I'll be spending some time modifying the settings on the hybrid bike to help me out. In terms of normal life, as I've said, I've become a little bit more irritating. But what I have noticed is an impact on my mood and psychology. So I'm not feeling mentally as well as I have done. And I think, there's a number of reasons around that. And a lot of men going through their 50s do suffer with, bouts of depression and stuff. But I think, the move on to the medication has kind of made me realise that, it's had quite a hard impact on my mental state and how I want to approach things. So I guess overall, is it working? The clinical team say yes, and absolutely it is. I'd say absolutely, from an energy, how I'm going about things, what I want to achieve and so on. And it's given me a little bit of a devil may care attitude to doing things, hence going to the Belgian Grand Prix this year to Marshall. So it's given me a bit of a devil may care. But I would say overall, I am feeling much, much better. And that's mainly down to the energy returning and things like that. So what's happening next? Over the coming weeks, and I've got another blood test coming kind of mid-September, and then I'll have another appointment and they will keep an eye on me. It will be a case of just keeping an eye on it. I will not stop taking this medication until either it stops working or I stop working. And I'm not planning on stopping working anytime soon, so it'll definitely be the former. And I think overall, I will be keeping an eye on things. The skin is probably the main thing I'll be keeping an eye on. And I will be asking them to examine the size of my spleen when I go for my next appointment. So those are probably the two biggest things I'll be looking at. I'll leave it there for today. Thanks very much, and I will speak to you on the next one.